Are we ready to go? All right. Welcome, everybody, and let's call to order this meeting of the Dunn County Health and Human Services Board for Thursday, October 23rd. Let the record show that all of the members of the committee are here. First item of business is the minutes from September 25th. Any
I'd like to
clarification needed, but a
No.
motion? All right, Dr. Hall moves. Is there a second? Supervisor Bashan seconds. Any discussion?
Yes, I've got two typos.
All right, Ms.
Small
Rudy, go
ones.
ahead.
Number 10, Rudy is with an I and not a Y, and then
Yes.
supervisor and 11 should have an S in it.
So we discussed that a moment ago. Thank you for bringing it up. Those corrections will get made. Any other additions or corrections? Additions or corrections? If not, all in favor say aye. Aye. Any opposed? All right, minutes from September 25th, 2025 are approved. Do we have any public comment? Nope. All right, let's move on then. The next meeting date, and we agreed last month that we are canceling November because it was Thanksgiving. It is likely that we're going to have to schedule a meeting in December because it seems like 2 months is too long to go. Particularly as the county manager has suggested, if we are asking for money. All right, so we would move that to December 18th. Yeah, is that good for everybody? You good? Yeah, yeah. All right, December 18th, and we'll send that notification out. Yes, Supervisor Steen.
The admin meeting.
Well, the admin meets before we do. Okay. I don't have a calendar in front of me. What's the 17th? Could you make it Wednesday, the 17th?
Sure.
Are we still good for 6 p.m.? All right. So we're going to meet on December 17th, Wednesday at 6 p.m. Maybe we'll find some holiday goodies. I thought you were in charge of the holiday goodies. Okay, all right, that sounds just wonderful. We will anticipate this. All right, all right. Veteran service. Greg is doing important business, and welcome, please.
Well, hello, everyone. My name is Amy Lynch, and I am the newest person in the Veteran Service Office. I'm the new program assistant, and I've been in the office about 6 months now.
And
Yeah,
from the frying pan into the fire, we're glad to have you.
thank you so much. I'm really enjoying my job there. I am a veteran. I spent 23 years retired in the United States Air Force and moved back home to Wisconsin. And then I before this job, I was part of the Independent Living Support Pilot Grant with the ADRC. And then now I've landed over in Veterans Land, but
Great.
yeah, so I'm enjoying that. So this evening, I have some notes on the local, state, and federal level.
Right.
Locally, the CVSO attended the Dunn County Housing Action Team meeting and local advocates team meeting this past month. And we work very closely in our office with Project Hope, assisting veterans sometimes with rent and security deposits for people who are leaving substance abuse training or treatment, I should say. Our office is working closely with HUD-VASH social workers to assist with prevention of unhoused veterans for a couple of, local folks. The office is going to participate in a Veterans Day event at the Neighbors of Dunn County and the Menominee Senior Center on November 11th. And recently of note, we participated with the local 434 Pipefitters Union for the Heats On program. And I got to see firsthand what a great outreach program that is. It's really well run, and we were able to serve several folks, a lot of surviving spouses
Yeah, I bet.
who had lost their loved one this past year. It's a way for us to wrap around and just take care of them a bit, so.
And we should do another thank you letter. We have done that for the last couple of years from this committee, just to acknowledge their work and how important it is to us. So we will take care of that.
That's wonderful. On the state side, the CVSO is wrapping up his tenure as the Wisconsin Association president this week. And we have a local veteran who is the featured speaker at the association banquet tonight. And I'm so jealous I can't be there to hear
I
that.
know.
He is going to continue to be part of the executive committee for another year. And also of note is that he presented to the UW-Madison Extension All-Colleague Exchange through an invitation from the UW Extension.
Supervisor Bashan.
Yeah.
Yes, I would just say it was my honor to introduce him on that. We had over 350 colleagues on the call, and it was recorded, so those not able to make it were able to watch later. And I got so many emails afterwards, just appreciative of what he shared and the opportunities going forward for people around the state to work with their county veteran service officers.
That's really nice. Thank you for doing that.
He wanted me to bring attention to the page 2 of the report for the specifics on how the government shutdown is impacting the
Yeah.
Veterans Administration services. Some things are thankfully not affected, but we are seeing some services temporarily suspended, such as the Transition Assistance Program, the GI Bill Hotline, and notably the VA Regional Benefits Offices,
Yeah.
which includes the Milwaukee office, and that's the only one in Wisconsin. So
Yeah, that
that's
looks
tough.
fairly serious.
He also wanted me to bring attention to the retroactive payments and clients served. Retroactive payments for September were $61,495.09. Client serve impact, we had the Ride Against Suicide bike ride come
Yeah.
through our area and stop here with us, and we got to spend some time with them. And that was a great cycling event held from September 10th through the 13th. And they just wanted to raise mental health awareness for veterans. So we were able to tag team on that and spread some awareness. And another highlight was that a recent Vietnam era vet was released after serving 18 months jail sentence. He's also partnering with Project Hope. And they were able to, the VSO was able to review his benefits and increase his amount of pension. So those are, it's interesting working in the office because those are the kind of things, the large and the small, it's
Yeah.
to get to see those little milestones happen for people every day is very rewarding, and it's great to work alongside them. Regarding the budget, we have used some relief funds to assist with utility disconnects and first month rent and security deposits for some local veterans. We are seeing that uptick in
Mhm.
assistance requests
Mhm.
at this time. And but Greg does not anticipate any budgeting concerns for this fiscal year.
Yeah, it looks like the budget is coming right down to the wire.
Yes. As I've heard, we do a lot with little, and it's but it's great to be able to do what we do. One event he wanted to bring awareness to is the Common Scams and Fraud Awareness presentation that the VSO and the ADRC are partnering together on, and that's coming up on November 6th. And the topic will be common scams and fraud targeting seniors and military identity theft. It's open to the public and we're hoping to get a large turnout. I know that Tracy Fisher and I have been working together to spread the word about that event. And lastly, we wanted to just bring in awareness about a bill that's in the works for the state of Wisconsin right now. And that it is proposing to lower from 5 years down to 3 years the residency requirement for veterans and their spouses and children under the tuition and fee remission program under circumstances in which the veteran was not a resident of the state when he or she entered military service. And I think that's, as a veteran and a retiree, I mean, I think that's a wonderful thing because it gives Wisconsin more of a stake in attracting veterans who may not have
Sure.
grown up here to come back here and make Wisconsin home.
Mr. Lamb.
Just, what was the program again that that hopefully will lower the residency requirement to 3? I didn't catch that.
Oh, okay.
There was a
sure.
copy of the statute in our packet.
Yeah,
Yeah.
for some reason I didn't print that.
Oh, okay,
Tuition and fee remission for UW.
Oh,
Yes.
okay,
that's right.
thanks.
And it looks like it's an amendment bill. 36.27 sub 2.
And I
Yeah,
would just
please,
say, as
Supervisor Bashan.
a current user of the Wisconsin GI Bill, I really appreciate this, because that is actually something that did kind of sway us towards Wisconsin. We're thinking of our children, and then now I'm in school as well, not thinking it'd ever be there again. Yeah.
Nice, thank you.
Other questions? Anything else? Thank you so much. Very informative report, and you're welcome back anytime.
Thank you.
All right, moving on to public health. KT, are you ready?
I am, thank you. So, I am so grateful for my team. So I have been out of state for the last 2 weeks, did a big vacation, spent some time at Superior, Lake Erie, and the Atlantic Ocean. So coming back in, it was a bit of a flurry. And so what you have in front of you is just some handouts that our nurse manager, Carrie Quilling, put together for you for updates. And so a lot of good things in there. Obviously, a lot of pictures. She knows that I love pictures. And so she went above and beyond to collect some really fantastic highlights of what the team has been doing. So a couple things I want to lift up from that you have in front of you. One is that as we look to make our spaces more inviting, we consistently have had amazing partnership from facilities to make that happen. And so Carrie is crafty. Can I just say that? So she made and printed these big screen prints, and then facilities came down and posted them. No question, super easy peasy. And so just really appreciative of the work that facilities does. And then another thing that's in here as well. So as you think about our harm reduction and injury prevention kiosk, it is a wide variety of harm reduction. And so one of the things in there, especially as we go towards the winter months where it gets colder and the elements are more, or rather less forgiving, we did have a fantastic donation from the First Congregational Church for handmade, they're adorable hats and neck gaiters.
Yep.
So that's in the kiosk as well, and we're really appreciative for that donation. So that's from public health nursing. Couple other things to share with you. One, environmental health. As you guys know, we've kind of forecasted, we need to update those fees. We are expecting the Department of Agriculture, Trade and Consumer Protection, ATCP 72, to actually get posted next week, which means it would go into effect 90 days from that posting, which is sometime around January-ish.
Yeah.
So as we bring fees to you in December, we will have a whole new categorize, that's not the word, but we have things in different buckets
Okay.
so that we align with ATPC 72. So that's important for you guys to look at. I would be really appreciative if we could get some approval at that meeting so that we are in accordance with the new reg when we have new facilities come through starting 2020.
Is DATCAP making major changes? as far as-
Significant changes.
Okay.
So they are changing their fee structure significantly so that there is not only a higher reimbursement rate for the locals to the state, but the actual fees themselves have gone up. And then they've changed the buckets. So there are a couple specialty lodging facilities, and Jeff will speak to it much
Yeah,
more
okay.
eloquently than I can, that we don't currently have in our structure. And so we do need to make some changes.
Okay.
Additionally, we are continuing to see funding for WIC, and that is at the state level. They're making sure that any kind of revenue that they can kind of pull and move into that, they are. So for example, the state has a contract with Abbott, who is the sole source formula maker. There are rebates that go back to the state. And so they're using that now to make sure that we're whole instead of when they would use it later. And so we're continuing to expect to have business as usual. And we are expecting to see additional clients who may be losing their SNAP benefits
Absolutely.
coming in, and as they are WIC eligible, receiving those food benefits as well as that nutrition support and breastfeeding education. And then another reason I'm very keen to see you in December is that you guys will remember that we had a reduction to Title X, and you just saw a budget adjustment out of the blue, literally. We were awarded $48,000 out of Title X to be used by the end of March. We did not ask for it, but we said we would take it if they had extras. They
Oh, yeah.
had unused funds in other projects, and so we are able to make use of it as long as the board approves it, obviously, and we can spend it appropriately before March. So that's going to keep us not only whole for this year, but exceed that. So it'll go towards next year where we expect a very significant decrease. We already had the notice of award for Title V, which is maternal child health as it relates to sexual health and family health, and our GPR, or the dedicated funding for STI clinics, going down. So we expect those to go down. So it's not as bad as it could be, but it's also very, very welcome to have that additional
Yeah,
funding.
exactly.
And I need permission to use that funding.
Yeah. Do you want to
Um,
talk about the pumpkins?
They look great.
So again, our team is amazing. And I think if we don't win, the voting's got to be rigged. So we partner with Bridging Brighter Smiles to provide free checkups for littles that are Medicare, Badger Care eligible. And they do that in partnership with our space. And so we had a clinic set to go into, wow, words. We had a clinic set up for Friday, and we wanted to announce that and encourage people to brush their teeth and pick up other things for dental hygiene, as they are also picking up candy. So the
Candy.
Birth to Three folks play group is going to come around tomorrow. No, a week from tomorrow. And we are excited to provide maybe not the best prize, but I would say a very good prize for trick-or-treaters. But yes,
Perfect.
don't you love the braces? Those
I love the
little
braces.
tops.
I thought the
Clever.
braces
Yeah.
were particularly awesome.
Any questions on the updates?
Any questions for KT? Yes, Dr. Hall.
So we have some schools in our county that have less than 60% immunization coverage with the MMR.
That is correct.
How many schools? Two.
And you'll remember that when I talk about our immunization rates, it's typically at 24 months. And so this is a different number, but I think it's a very important number as we look at measles and measles protection. We were notified that a case out of Minnesota had been in our area, And it was so late that we would have already seen cases. So thankfully we have no cases, but it was in a very vaccinated faith community. And it was in the family participated in a very unvaccinated school. So on the other side of the river. So grateful that we did not have any additional cases, but that is something we watch very closely.
Other questions for KT, Mr. Lamb?
Just two quick ones, the AdCap 72 and the fees you talked about. I'm assuming you'll have like a package and we can vote on it in December?
Yes,
Okay.
so you'll see the same thing that you saw last year when
Yeah.
we give you the breakdown on those fees, how much it recoups the cost of the program as it relates to our 3-year 100% time tracking average. And we'll ask for your feedback, and you can give us feedback to say no fees for anybody, or we'd really like to see you at 110% of cost. You're not going to choose either of those things, but what I'm
No, I
saying
don't
is
think
that
so.
we'll put a couple things in front of you, we'll seek direction, and then we'll put, unless it's right on the money, we'll put that back in front of you in January for a vote.
Yes,
Okay.
go ahead, Dr. Hall.
Oh, the other one is
Oh,
real
sorry.
quick. Remind me, what's Title 10 again? Does that
So-
cover?
So Title 10 is federal funding for sexual health, and so
Yeah.
yes, okay.
I just forgot.
Yeah, Title 9, Title 10, Title 5, yes. And then it's doubly confusing in that oftentimes I'll just shorthand it with an X. I cut you off.
No, that's okay.
Dr.
So,
Hall.
so my question was, so we're gonna look at proposed new fees with these different categorizations of different types of facilities. And if I'm catching everything correctly, the state is going to be asking us to send more money to them.
Correct.
So that means that if we're going to not take a huge hit, we're going to have to charge more money to the facilities. And if I'm remembering, we looked at those proposed new fees from the state, and some of them are like double what they used to be.
Yes.
Okay,
Mhm.
thank you.
And one of the things that Jeff will do, and you'll see this, he will break out what the state portion is and what our portion is, and we will communicate that effectively to our licensed facilities.
Good.
Because it is substantial, and while our need might not increase significantly, the state portion will increase. Yeah.
Yeah, and do remember that we've accepted some boundaries for that 70 to 100% of recouped time. So go
Okay.
ahead, unless there's anything else for KT. All right, go
So-
ahead.
Financials. So you have what I expect to be your last projection from the health department, unless something substantively changed. So we were notified at our department head meeting yesterday that with the vacancy in the CFO position, that there are some prioritizations of things that need to happen and don't happen. And so where there are challenges around watching those budgets really closely, there is going to be some one-on-one work for projections. I'm grateful that the health department is not in that bucket at this moment in time. And so we expect to come in well above what our budgeted amount is. I'm sorry.
This isn't you. It's not you.
I'm just really confused at the moment. But we'll continue to pull basically the 5-column budget that Greg pulls out of SAP to give you a guidepost. But what we will not have is the upkeep that the CFO really kind of was responsible for managing, which is a big multi-pivot table spreadsheet with the projections. So just for your awareness. But as you see from what you have in front of you, we are projecting about 64,000 to the good. And we know that there are a couple things in here that are not reflective of budget adjustments that you've already approved. It takes a little bit of time to get it from your approval into SAP. So just for your awareness. So I think we're in really good shape.
Any questions for KT on finances? Supervisor Breslin, just for your information, these materials from Public Health were distributed as we speak, and so we will make sure that you get them.
Thank you very much.
You're welcome. All right. And she was anticipating that it was her turn. You're fine.
All right. First of all, my director's report. In the director's report, I had the latest information at that date regarding the food share,
Mhm.
inability to receive November food share allotments. Their daily things are coming out regarding that. The latest information is that the November food share update, which comes out typically the last week of October, depending on kind of the social security number, last digits participants receive them, will not be uploaded on their card. Well, it will be uploaded on their card, but they're not usable. So make it
That's
look
what I
like they
thought
have
I had
money.
read.
Will
they
make
did-
it look like it, but when they go to the store, it will not be
It
usable.
won't work, yeah.
And they're unsure yet because the federal government has not released the information whether if they have benefits they haven't fully used in October, if those will be eligible in November or not. They may not be able to use any of it, even if they have some that they've not used. And so with that information, typically our programs do not tell people buy stuff and stock it, right? Because
Of course not.
food goes bad, all of those things, buy it as you need it, but there's some look of that may not be an option. So make sure that you're using up your benefits this month before November 1st hits. So there's, as I said, there's every day we're getting kind of updates as to new language. They really advise us to have any media contact go to DHS with the state because they want consistent messaging going out
Yeah.
and those kinds of things. So there's a lot of information out there, concern about food pantries, all
Yeah.
of those kinds of things. I know we are doing a donation here drive.
Yes, that's
because,
great.
we're concerned about that with individuals and just knowing that they've had a lot of cuts too. So people
They've had a
aren't
lot
gonna
of, they've
go,
had a lot of cuts and have
Yeah.
cut back hours and
yeah.
times and so on.
Yeah,
So
so-
donations and stepping stones would be appreciated. Dr. Hall?
So Paula, I have a question just to help me understand kind of the scope of what families might be dealing with. Can you, and I apologize to throw this at you without warning, but so a typical family that gets food share benefits is, and I know the amount has gone down, but are we talking it's $50 worth of groceries that they'll no longer be able to get, $150, $300? What kind of range of monetary benefit?
It really depends on the income that they have, how many children, all of those kinds of things. A single adult, like an aging person, might get $19 a month, and that helps them get by. And in other cases, if there's more there, like they're raising a grandchild, that could go up. For families, it just depends on, it can be $200 to $400 a month, but they make that go a long ways when you have kids coming home from school hungry, want them fed before school, all of those kinds of things. So that's a hard thing. They're already struggling with the price of groceries with
Yeah.
some of the reductions we've had. So it's a significant impact. And even if for some reason the stars align and we can have the federal government open back up, they may not be able to get those benefits as typical. So it may take some time anyway to do that because we're kind of past that mark already.
Dr. Hall?
So I know that there are, there's Thursday's table and Tuesday's table. So there are organizations that provide meals for folks
4 days a week.
4 days a week, right? Dinners only. So it's limited. And I know that they have their own limitations and budget concerns. My question is, because I've often wondered this, is there any centralized place where someone can go to find out where the different things are the different days?
So there's not a centralized place. I mean, they can come to the ADRC, they can call our office, they can call Stepping Stones, but we do have the Health Done Right handout,
The
and that
resource
has
guide.
the resource guide, and that has all of that in there, and that is widely spread both physically and
And it's
electronically.
on paper and it's also online. So
Yeah.
it is
So
a
we do-
nice centralized accessible place.
Yep.
So I'm wondering if maybe it might make sense as we look heading into this really difficult time to maybe with the county's social media, direct people there, remind
good
people
idea.
that that's there.
That's a good
Really
idea.
good idea.
Okay,
Yeah.
thanks.
Yeah, thank you for that. The other impact that um, indirectly impacts our department, but certainly directs consumers, is the marketplace insurance. So Badger Care Medicaid is still running, and that's in effect. But the marketplace, this is the time of year that people sign up for marketplace. And because the tax credit plan has been held up, what we believe is going to happen, what we're being told, is that people will get their bills, those that are on the marketplace insurance, and you can predict they're going to be at least doubled. And so the concern is you get that, you go, I can't afford that. They get dropped from their program, or they choose not to do that. And then we have people needing significant mental health or physical health. And the trickle down effect, certainly for our department, is the emergency room, mental health crisis stays, mental health therapy, all the things that people can access when they have insurance will be gone, and our department picks up some of those invoices, those bills, including if people are in an institution or residential placement, or ordered by court to like a group home. If there's medical needs that they have that they don't have insurance and it's life or death kind of needs, kind of like the jail, we're on the hook for those. So if you have kidney problems, we pay for kidney medicine. If you have, I mean, so all of those things come with it as well. We try to work around as best as we can, but if people don't have insurance, that comes back to us.
Right.
So of course, we're concerned about the community, we're concerned about the impact to people and families, and then we're concerned about a budget that's already not in good shape. So those are significant impacts to our department. So I wanted to share like kind of the up to date on that. Any questions
Any
there?
questions for Paula? Go ahead then.
Okay, now I'm going to find my spreadsheets that I was trying to make sure that I had access to. Okay, so last month I said that I would share the out-of-home placement cost with you. So I have them, wasn't able to get them in the packet, but I have them to put up on the screen for you. Let's see if that's, can I make that bigger? Is that big enough or should I try bigger?
Try a little bigger.
That, okay, okay. So this one is foster care administration, and subsidized guardianship. So there's 3 different slides for you to see. So there's regular foster care, which may be somebody in our loving community that says, yep, I want to take on a foster child, and that child doesn't have a lot of special needs. So we pay them a foster care rate that they receive based on an assessment of their needs. And then there is treatment foster care, which is typically foster care in families that work with an agency. And it's typically because children have higher needs. And so then they have an administrative cost for that. So we pay for the placement, the cost of that. And then we pay an administration fee. So they usually have social workers that are helping coordinate care and all of those kinds of things. It is pretty typical that the administrative fee is as much as the foster home payment. So they're pretty right in there with each other. So it doubles, if not more, the expense. And then you're talking about a high cost placement because these kids usually have typically higher needs. And so And then subsidized guardianship is individuals that are caring for kids that have a plan that the court says, or the permanency plan says, this might be the plan until you graduate. So it's a home or a foster home that take children, and then their intent then is to keep them and help them become young adults. So for some reason, it's not appropriate for the family's rights to be terminated. Maybe they're too old to be adopted, all of those kinds of things. So then we have subsidized guardianship as a form of care. So those are the three that are on this sheet. You can see here that we had a real crisis year in 2023.
Yeah, the numbers really
The
spiked.
numbers were really, really spiked there. But what I want to really demonstrate here is that this is a typical trend for counties right now. When I talk to other directors, that we have less kids in care, but the costs are so much higher because of the technical needs that the children have. There's such significant mental health needs. They a lot of times need one-on-one monitoring or assistance and supports, just like the schools are experiencing that higher cost because they're needing that one-on-one. That's what's happening in the homes too. And so that is the trend of what's happening in the last couple of years as you look at those numbers and cost in that. I'm going to not make you dizzy, but here's the numbers. So you can see in these categories, we have 27 children in foster care this year, 6 in treatment foster care, and then 17 in the guardianship place. But you can see the dollars that are connected to that. When we had 48 kids in care in 2020, it was 288,000. And with 27 kids, it's 313,000. So that's a big difference with a lot less kids. And so then you can see the administration costs there. Those kids, 6 kids, and it's costing us $80,000 just for the administration. Now, that's not the foster care end because that's calculated in the first column. That's just the social worker and the agency paying for those systems. And then subsidized guardianship. We do currently receive reimbursement from the state for subsidized guardianships. That can change at any moment with the stroke of a pen, but right now at this time, we do receive that reimbursement there. So that is good news. But of course, the rest of them are not reimbursed at that level. I'm going to go to the next one. Oh, now I got to go all the way back. I'm sorry. With me here. This is what I was rudely doing while KT was talking.
Yeah,
trying to get to this to
they
get
were
it
all,
up.
they were all
I'm
separate.
sorry, yeah, they're all
all
separate.
separate.
So, kinship is the next one. I want to share with you. Let's get that bigger. All right, so kinship is a term that we use when there's a family member or natural support that knows the child or potentially a relative that's never even had any connection with the family, but there's some type of kin or like kin. It can be, they passed a new law that it can be like kin. So I can have a boyfriend for many years and that just felt weird to say when I'm married.
It's okay, we won't tell him.
I'm going to give you this example. Someone can have a boyfriend for many years, and a mother can, and have her own children and not the boyfriend's children. And the mother can have the children go in care, and we can place the child with the previous boyfriend. She may not even be with him, but they might have a relationship because they were kind of parented or whatever from that person that's no kinship, really blood kinship with them. But now they passed legislation that says we can do that and receive kinship funding for like like kin because it's somebody that that child's connected with. And so kinship payments are much less. I can't even remember. I think it's like $365 or somewhere in there per month per child. So it's significantly less, but it is something that helps those kin families to be able to, get some extra school clothing or those kinds of things to help support that. We do receive kinship care. They typically at the end of the year, they'll look at it and go, okay, Dunn County, you overspent your budget by this much. We're going to backfill that in. So typically we do receive that in kinship care. And it is really when we look at children in out-of-home care, this is the golden ticket. This is what we want for everybody is those kinship, somebody that's part of a family and those connections, somebody that has the same traditions and, history and those kinds of things, if they can be there safely. So this is the least cost and the best outcomes typically for families. And I'll just give you the dollars there. So we've kind of stayed between 60, 80 kids in kinship care. And our current projected cost is $210,000 this year with that. Can I hit close? Oh, you're so smart. Thank you. I obviously need some IT lessons. Right. Nope, I gotta go bigger on this.
This is the scary one.
This is the scary one.
Eeky.
All right. So, as always, the group homes, the residential care centers, which is what RCC stands for, and juvenile detention are our highest costs. One kid can blow this budget, right? So, we've had more than one kid, as you know, this year, right? So if you look at where we're projected for 2025, we are at a total, let's see, we have 10 kids. No, wait a minute. I got to get the numbers here down below. We have 12 kids that are in group homes for a total cost of 410. Let me pull that up so you can see what I'm talking about here. So,
But that's since 2020, right? If I'm reading this correctly?
Yeah.
yes, so
Yeah,
that's
so there-
totally there. So two this year,
You're right.
two
Okay,
this
thank
year
you.
for a
Yeah.
total of 88,659. Thank you. And then in the residential care centers, we have 3, which is 525,000. And then 2 kids in the juvenile secure detention this year, which of course is the 440,000. The one you were aware of, we had the youth that was in Lincoln Hills, Mendota timeframe, and then we have a kid that's been in the program in Eau Claire in the juvenile security detention. And so that is bendy as well. I think I have that here. So security detention. It doesn't have this on here, that individual cost. The Mendota was $1,268 a day. And that use left July 30th. And then we have the other one in the secure. I don't have that actual breakdown. But anyway, that's where we're at with those numbers. So when you look at this, you can get a little sense of why our budget is in the position that it's in. And when you look at the bar graphs, it certainly tells you the difference in the last few years of what that means.
And if I understand you correctly, that's a result perhaps of increasingly complex mental health issues.
Yep. Yep.
And a generalized absence of mental health services. Yeah.
Services or family dynamics and complex trauma, those types of things on top of there. There's, so many more high diagnoses of this really severe mental health that we're seeing. Complex, very complex. Schizophrenia. I mean, there's just the high end of the kids. So, and at really young ages as well as the youth. So there's that piece of it. These charts are in the Teams folder. If you
Yes.
go in there, you
Yes.
can see them. If you want me to print you some, you can let me know that too. I can do that or email that to you if you don't, can't navigate it in there. So there's that. Yeah.
Yes, Dr. Hull.
So I think we've talked about, or I think I've brought this up before, these costs, which can be so astronomical. And we're a relatively large, well-resourced county compared to many other ones in the state, right? And you can't control if you have one or two youth who are in need of these types of services. So it absolutely boggles my mind that we hold individual counties responsible for covering these costs when really we should distribute the risk, and this should be a state level thing because it doesn't make any sense to do it this way. So as we think about legislative priorities and as we think about, what we want to say we think is really important, this seems like a no-brainer to me that
I agree. Totally agree.
that this is not the appropriate unit of government to be responsible for this type of cost because it is so, what they call is stochastic, right? It can be nothing or it can be an astronomical amount, right? It's so unpredictable. But if you increase the risk pool by making it a statewide thing that it's covered at the statewide level, then it's not going to be so up and down and not disproportionately impact any one area. So something that I would like us to consider as a legislative priority.
It's in there, but
Yeah,
on
it's,
the
it,
list.
it, it it is.
It
It's
is
on the list.
So,
But
yeah.
this has been a problem for years. So,
It just so happens that, right before we had our Lincoln Hills placement, I was on a director call with the state, and, Kenosha County was talking about the impact of Lincoln Hills placements and the cost, and the director said, all right, you small counties, it only takes one kid and your budget will
Exactly.
be blown. And it was like a month later, I sat there going, what? Here it
Yeah.
is for Dunn County,
Yeah,
because when I
one
was on the
kid.
call, I'm like, oh, thank you, we're not there, but, it doesn't take much of anything to get us there. So, yeah.
And it could be a persistent pattern, that kid.
Mhm,
Right, it could be 10
could-
years.
It
worth
could,
of that.
absolutely.
mhm, mhm,
Very scary.
yeah. And then I want to go back. Let's go back here again. All right. So next. That to go. There it is. This is your, oops, monthly education on human services funding. I'm gonna, oh, it's not, it says, yes. No. How's that? Okay. I don't know if I can make it bigger or not, but.
Thank you.
So,
See that.
there's extra, Gary, that will go to Diane afterwards, because she can hand them out at the executive committee if she wishes. All right,
Or Gary can.
or Gary can, yeah. During during your conversation about human services is what I was thinking.
Yep.
All right, so I think this one is very timely because in the 2026 budget, there's been some changes as to how indirect costs are being allocated to some departments, including human services. So I thought it would be a really good time to talk about what does this mean and the impact and those kinds of things. So, so how does Dunn County save money with indirect and AMSO? So first of all, departments that receive grants, some grants allow you to charge things like AMSO and
Mhm.
indirect. And I didn't catch that it wasn't on that document of the definition of what AMSO is, so Gary watched me handwrite them out as we were talking earlier on the back side of your paper, the definition of AMSO. Because I know that AMSO doesn't just normally pop up to people to say, what does that
But
mean?
you see it every
Thought it was
month in
Amsoil.
your,
And
you see it every
some,
month
yeah.
in your vouchers.
Yeah,
so-
you do, but
you
maybe
do.
the other board members don't, that's not
Right.
as common. So
Right.
so AMSO is the administration, management, support, and overhead, which is really the things that make the department run from the top, but isn't really associated with any programming. So my salary, some of Becky's salary, fiscal, those kinds of things. And support staff that answer the phone for everyone. So we have AMSO and that we can bill back to grants. And then there's indirect that can also be billed back to grants. And a lot of the grants tell us, or state county contracts, they tell us you can bill 10% for indirect and AMSO or whatever percentage. So we bill whatever we can to that. And so with that, we're able to reimburse for those operational costs. If a department is fully tax levy, they have no ability to bill for
Right.
those things because there's no grant to bill it because it's coming in
Exactly.
tax levy, right? So does that make sense?
Yeah.
Any questions about
Any
that?
questions for Paula on that?
Yeah,
Okay.
so what that does is then helps cover the cost of those positions. So if human services was 100% tax levy, you'd be paying for my position with all tax levy. But instead of that, you're able to bill those grants and those types of things. So also the indirect is services like HR, payroll, facilities, maintenance, some of Dan's salary,
Sure.
taxes, the piece that we use for some of that. So indirect does that.
Excuse
We already
me.
talked about AMSO. We based that by FTE in our department. So I think we're roughly at 100 staff now. And so we divide all of those costs by the 100 staff, and then it says Paula's portion of this is that much, and Becky's is this much, and the next person. And so that's billed per people. So if a program has 15 people, then 15% of that, because we got talking 100 here, would be billed to those programs, and then billed to the other programs. ADRC would bill their staff to their program, and that it's based by the person, by the FTE. All right. So we identify, we have some methods. AMSO is part of our budget that we figure out. Indirect comes from a calculation from a company. I don't know if it's Maximus do we use here, or I'm sorry, Dan, not meaning to put you on the spot, but there's a company that comes and says, this is how much your indirect costs are, and this is how much each department would pay for that. All right. So based on that, that's how we get those figures. By pulling this money in, we're not having to use tax levy for that. So that's what this graph is showing in the areas that we have those grants. Obviously, in the areas that we have tax levy, then that's not coming forward. Yep, so I think this is kind of saying the same thing. So without those reimbursement methods, we would need roughly $3 million in tax levy to cover our AMSO indirect. But we receive that from the grants that we have. So that's like a $3 million savings that we bring in through other methods, right? And that we don't ask for tax levy for, where some other departments do because they don't have that opportunity. I think that's kind of the same thing. So I'm going to get out of here. It goes over the same stuff again, but what I wanted to share is in 2026, this looks different. It used to be that all the funds that came in from those grants would just stay in our department. And we would keep it here and be able to use that as funding instead of saying like that $3 million, then we would just use that for other expenses that we have and not for ask for $3 million more in funding from tax levy
Right.
to balance. It just stayed within our budget to help us operating costs and those kinds of things. This year, in 2026, we are, or it was been set up that I think it's 80% of that portion would go back into the county treasurers because some of that, like indirect and that is paid for by county tax levy and right, the Dan's position and all that is paid for then. And then we are receiving additional tax levy to backfill that. So it's just a reverse, but it's allowing us to really track kind of what that is and how it's flowing. And so we did receive tax levy for that area, but we'll be paying that in. So if you see our budget in the detail, you will see that. And it's kind of just an in and out of that. We're able to keep the 20%, I believe, if I have that right, Dan, right? Yeah. So 20% we keep, the 80% gets filtered back. So we actually, it's a little bonus bingo for us in that end. But so there's a little change in that and what that looks like for us. And it's just really kind of cleaning up the account lines. But the document shows you kind of what that does for our department and how grateful we are to be able to have those grants and things to be able to build them and not be asking for additional tax levy for those things. So any questions on that area?
Any questions on administrative overhead or indirect costs for Paula? Not a question. Well done.
Okay, thank you. All right, so what's next? Oh, my financial report. Now we're
financial
really
report.
gonna have fun, huh?
Yeah.
All right, look at that.
Yeah, this is not the best.
Yeah, this is not the fun one. All right,
Can you make that a little bigger
I'm-
on screen?
is that, then I'll just go over a little bit.
Yeah. We when we have it. So.
Yeah. Okay. So here we are, and then I get this little screen pop up here. Here we are in October, but really knowing that this is probably September's invoices typically, and maybe even a little, a little bit still comes in that maybe would be into November as far as the expenses. And then the revenue is typically 2 months behind, except for tax levy. We get that right up front, right? So currently we are sitting at a negative 373,967. Now, last month I reported to you that it was $40,000 more to the negative.
Right.
40,000 added to the negative. I'm not saying that right. Financial people would say, what are you saying here? But
It was bigger.
it was bigger, $40,000 bigger. It was worse. And so when we met with Jerry to talk about why some of that is, there's been some placements that have gone home. And so they were projected for the end of the year. And because they actually returned sooner than what was projected, that decreased our projection by 40,000. So that's why we have a difference in there. But still 373 is a heavy number.
Madam Chairman, I have a
Yes,
question.
Supervisor Steen, please.
I see year-to-date, 2025 actual 1.1 million. But you're saying projected at the end, it'll be 373.
Yep.
So what's going to influence that massive drop?
So what that is we're actually right now $1.1 million in the negative. But remember, our revenue is 2 months behind. So we're projecting we're going to get that revenue to help cover those expenses because of that. So what we bill and claim and all of those kinds of things. So that's why we have the projected so that you can see, what we're expecting or believing will be.
That's one of the things that's always been really hard to grasp and grapple with is the late payments on things because we never know how we're going to end up.
Actually, we don't really know until we get out to about March.
right?
Well, pretty much.
Yeah.
Yeah, I mean, it's December 31st means nothing. Yeah,
And really, that's why typically January, February, March, we still are giving you a report on the previous year.
right.
And the new numbers mean
The no
absolutely
numbers
nothing.
mean nothing.
The new numbers mean nothing. It doesn't even make sense to give you a report because all it's in, it's a false projection because we get this nice load of tax levy. It looks like we're doing really good. And then we have no of the other revenue and our bills haven't come in yet. So we look like we're
Yeah.
really wonderful those first 3 months. And so to me, spending time doing that doesn't make sense. What really the time that we need to work on is what does our previous year look like and how close are
Right.
we getting to
Supervisor
what's
Steen, go ahead.
projected?
Yeah, this could be directed at Madam Chairman or Dan. The change in the human services being able to keep whatever they got. How does that relate to our plan to have every department have a certain level that they can keep? Do you follow what I'm trying to say?
Yeah, he does.
Can I say, I don't want to keep this 373 negative. I just want to say
Let's
that.
send that one to highway.
Unfortunately, you get to hold on to it. So yeah, really what that'll look like is we'll be tracking that. So if you do look at the budget book you have, you'll see there is a projection
Got it.
which has the extra $40,000 in it. As a negative projection at the end of the year. So, you know, the desire there is there's no placements in 2026. You pay back that 400,000 and you build that back up. There was actually a communication amongst the county administrators and coordinators in the area talking about what does each county do, and really we were the outlier in the fact that we didn't have some sort of a cushion or protection built in there, and that aligns to the number that we set is borrowed it from St. Croix County, and I don't know, I kind of love the way that he said it, other than it's really confusing. Plus or minus 3% of 10% of expenses. Short version,
Run that
7
again.
to 13. So when you look at your total expenses, here is, which number is that?
17,734.
Mhm.
Yeah. So you take essentially 10% of that would be 1.7 million. So that's kind of that target is that 10%. So that's how much you could hold. So when there is that bad year and that bar graph spikes up, you'd be able to handle that. And if we would have been doing this for the last 5 years, you would have $1.7 million to be able to handle this year.
Yeah.
So,
It just was a bad year to start it.
yep.
But we'll
Well,
work through it.
Thank you, Dan, and thank you.
yeah, thanks
Madam Chair.
thanks for the explanation. Yes, Supervisor Steen, did you have another question? Thank you, Dan. Anything else?
I think that's all I have until we get to resolutions.
All right. Next item up is the DHS September vouchers. And everybody will remember, I don't think it needs much clarification. This is essentially our checkbook. And the number is $211,000, $915.15 for September. Any additional, I'm sorry, Mr. Lamb.
No. Oh,
He's prepared.
yes, I'm getting ready.
All right. Does anybody need any additional clarification on these? All right, the motion is to note review. Mr. Lamb?
I'll move that we noted review.
All right,
I'll
Mr.
second
Lamb
it.
approves. Supervisor Steen seconds. Any further discussion? Any further discussion? All right, all in favor, say aye. Any opposed? All right, the vouchers for September are noted. Do you want to pick this up on the resolution, the next item?
Sure. Which one's first?
The
Okay,
SNAP.
Okay. All right. So, you want me to pull that resolution up or do you have it?
Well, why don't you pull it up? Because it got a
Okay.
little confusing in the packet and I had to
Okay.
raise questions today.
Yeah,
Like, what's happening here?
yeah. And so, let me get it here. I'll tell you what happened while I'm finding it. um, I had moved wait a minute. No, I gotta go back here. I had moved the agenda or the draft resolution that WCA had
Right?
drafted, sent out. I had put some local language in it. And then
We did look at that document last month.
but this had the local language in it. And then, oh, wrong one. And then what happened is after dropping it in this folder, Dan wisely said, you need to run this past Jim, which I had forgot to do. So,
Corporation Council.
yep. And so then we did that and Jim updated some format. I'm struggling here, you guys. Get that out of there.
He changed some format stuff and Andrew, the
Yeah.
county clerk, added some stuff, so.
Stuff too. So why isn't this? Maybe it's in the next section. I'm sorry.
Huh?
You still like it.
What?
Thank you.
They both do.
Yep.
They both do.
So anyway, both of them got in the packet accidentally because that other one was in there and then I had Cassie drop this one in and the other one didn't get removed.
So this is
So-
the one with the box at the top.
Yep.
That we are considering.
Yes,
Okay.
it's in our format and it's in the correct language as our resolutions do. So this looks the same as you've seen it last month, except for I added the, let's see here. How many is that? 1, 2, 3, 4, 5, 6. The 6 from the bottom, whereas 1, 2, 3, 4, 5,
Yeah.
6. So here it is. In the Dunn County Department of Human Services currently projects 504,938 in federal revenue in the budget from the IM federal match. And that includes the AMZO and indirect. And where I got that was from our 2026 budget projections. I was working with Great Rivers to try to give me a drill down because we get some revenue that helps offset some of this. And I didn't get that information before this packet could go out. And so I did get that afterwards. And the correct number is $223,423. So I would like permission to adjust this resolution to say
To
those correct
include, just
numbers.
to include that amount, that,
Right,
yeah.
that corrected amount.
Any
because
objections here?
I want
I
to,
have a question.
Yes, please, Dr. Hull.
So that 200 and some thousand that you just talked about, that's how much we were expecting to get from the federal government. And so my understanding is then we're going to get half of that.
no. So it would have been like 500,000.
Okay.
But drilling it down to 25% less, the 25% less is $223,423. We expected to receive that amount would have equaled the 50%.
Right.
So now that it's 25, we will be to the negative $223,423. Am I saying that?
Yeah, you are.
Right.
Mr. Lamb?
We're getting half as much money as we used to, because we used to get 50% and now we're gonna get
Exactly.
25%.
Exactly.
And the 25% that we're not getting equals the 223.
Mr.
Perfect,
Lamb is
thank you.
Ahead of you, Gary.
Sure, so on the resolution, if I got this right, on the top of page 2, where it says 504,90, it should be the 223
Yes.
number. Okay,
423.
Yeah, that would be the only change.
yeah, got it.
Dr. Hall?
So I feel like from a communication standpoint, rather than saying we're gonna get 200 some $1,000s from the government, we should say we are going to be getting 200 some $1,000s less
Less.
than.
Okay.
Okay. Supervisor Steen?
Yes, would the correct approach be to amend the proposed resolution to this? And I think it would be.
I think it probably is. No, I do not have a motion.
Mhm.
So remind me, Dan, I need a motion on the resolution and then a motion to amend, yeah? No.
You can make a motion to approve the resolution.
As a- as a-
Amended, and
I would so move to make a motion to approve the resolution as amended.
thank you Supervisor Steen. Is there a second?
I'll
Mr.
second.
Mr. Lamb seconds. And again, the change in language on the first whereas, on the second page, the currently projects $232,000 less.
223,000.
23, I don't know, I keep saying
Yep,
233 in my head.
but less, yep,
Okay,
that's a good.
all right. We okay with this? Any additional clarification on this, Supervisor Bashan?
But on the bottom, it would be offered by us instead of Committee on Administration.
It actually has to go to committee.
It has to go to admin, but yeah, well, that's what I thought today, but then both of them were supposed to go to admin and
Yeah.
That doesn't- Okay.
So we
yeah,
wanna
and that's
change
why
that?
we actually pushed this up. So it would go to Supervisor Steen's legislative committee and then to the board.
So I think that's a new amendment, right?
Correct.
I'd like to move to amend the motion to change this to offered by the Legislative Committee.
All right, is there a second on the amendment? Dr. Hall seconds. All right, any further discussion or clarification on this issue, which gets more complicated by the second?
So now that's just the amendment.
Right, I got that. I got that part. All right, all in favor? Any opposed? All right, and now we move on to the resolution as amended twice, right? And we have a motion and a second.
I so move.
We already did.
We already have that.
I'm just a moving son of a gun.
You just scared me, Gary. I'm trying to keep some semblance of order here. All right, any further discussion or clarification?
No, I want to share.
Anything else? Ms. Winter?
No.
Okay, all right, ready to vote? All in favor?
Aye.
Any opposed? Resolution passes, and this will go to the Legislative Committee in November. 5th?
10th.
10th, 5th.
This.
Did this just get changed because the language typically says that it goes to admin? I'm raising these questions today saying, this doesn't look right. Huh? Okay, all right, perfect. All right, so we don't need the second resolution. All right.
But we do need the budget amendment resolution.
Right, and we need the legislative committee to, that comes ahead.
Yep. Oh, it comes ahead?
Yeah,
Oh,
it
we gotta
is.
go
It
back
com-
then.
It comes ahead. So you have a long document in your packet that, and in your packet, it was deeply color coded, which I didn't understand until I read it. The color coding indicated changes to the document. This started out to be our legislative agenda from the previous year. And I suggested that the DHS staff take a look at it and add additional things. So there is another document that got added to the packet that is not color coded, if it's easier for you to read. So the changes are the language under child welfare and youth justice systems update. Color one, the blue is the change, right?
Yeah,
And the yellow is not changed.
I can't get that to open up.
Yeah, there was a green one too that I didn't get. I think it's a change. It is a change.
My staff highlighted what they did in their colors, so they were like, okay, mine is green, this is, and I didn't think it would go out that way, but it did, so.
But it did.
It,
'Cause there are
so
too
I took them
many
off,
cooks
but
in the
yeah.
packet broth,
I think
as
so.
it were.
They are good with their colors.
All right, so I
can't
think
get
that
this to
the
open.
Health and Human Services legislative agenda, our recommendations to the legislature for changes is probably the longest in the county. But I would like to get this moving forward, particularly since we're not going to meet next month. And it will need to get to the legislative committee and, further on to the board. So do we need any additional clarification on the changes that got made here or anything else? No? All right, then I would like a motion to approve the 2026 legislative agenda and move it forward to the legislative committee.
So I can make a motion and we can discuss, or can I ask?
Yeah, no, we're going to discuss
Okay.
after the motion.
So I'll move.
All right, is there a second?
I'll second.
Mr. Lamb seconds. Yes, Dr. Hall.
Thank you. So reading through this as someone who is already familiar with a lot of these things, it's pretty wordy and complex. And so I just have concerns about its readability and effectiveness as a communication tool for its intended audience. Not that the detail isn't important, and I know oftentimes the devil is in the detail, but it is not an easy read. But the thing that stands out, and obviously this is something I have a bee in my bonnet about, these high cost residential placements, and elsewhere in the document, we say what we want, and we're very concrete. We want this percent increase, or we want $21 million annually for Medicaid reimbursable crisis intervention, right? So it's very concrete and specific. And so I would love to see, rather than saying it's crucial that we continue to assess funding strategies, enhance cross-system collaboration, I want to come out and say, we would advocate that these costs should be a statewide expense that are shared at the state level rather than the individual county level. And maybe that's just my thing, but I just feel like we should be a little bit more directive, if other folks agree with me, that it would make more sense for those types of high ticket items to be paid for at a different level of governance.
You have a couple of, go ahead, Mr. Lim.
No,
No, go ahead.
I'm following what Dr. Hall's saying, but if aren't those costs, they're pushed down to the counties.
Right.
Yeah, so, yeah, so this form would be the more appropriate way to do it since it's coming from us as a county. Is that a fair way to put it? Okay.
Then you have a couple of options here. I mean, we have a motion to approve. You could certainly ask for language amending. Or we could go with this for 2026. I don't know what the plans are to share the legislative. I mean, we've had various issues with it. We've invited legislators to come and they don't come. And so I don't know what the plans are for this year. I don't think we've really talked about the whole agenda for a while.
Yeah. So, I guess first of all, the plan related to that is I had asked for department heads to start working on this to get this information to the committees. The approved plan from the legislative committee, it was in May of this year.
Oh, I
If
forgot.
you remember, there was some
I forgot.
options associated with that. So the plan was to get that approved in February. So the full agenda would get approved by the county board in February. So you do have time. You have a couple of more meetings in order to get that to either, this committee would have to adopt it in your final version in your January meeting in order to get it to the
Yeah.
February legislative. So you have some time to be able to work on that. After that, the plan is to kind of take that agenda, and we would share that with the legislature, with the legislators, to be able to do that. But as opposed to trying to get them all here to go talk about that, it's going to be more one-on-one sessions with myself, Supervisor Steen, Supervisor McCullough, meeting one-on-one with the legislators to go over each
Much
of those
more-
items and
Much more effective.
have those conversations. So I think I hear what you're saying. So there's a level of having that document that has this is what we want, but there's also really just some guidance as we have those one-on-one conversations for me, I think specifically to say, this is what the county feels, right? I am not an elected official. I don't have opinions. You guys tell me what my opinion is, and then I kind of go with it. And so that's really, it's that guidance document is I think the big thing. So there's maybe recommendations of this would be a good way, but realistically, we'll take any money you'll give us is
Yeah,
the
exactly.
ultimate side of
Rarely,
it. So
if ever happens.
yeah.
Yes, Supervisor Steen.
On the county board level, a lot of times we'll get resolutions or things to us and they'll have the legal language and then they'll have the reasoning behind it. Would that be a better way, following what,
Yeah, I think this is the asks are too complex.
this way?
Well, to do it, single issue with the rationale.
Just a thought.
Okay.
But is it my
Dr. Hall.
I guess my question is, what will be most helpful to you and Supervisor Steen and, is it Supervisor McCullough or Chair
Chair
McCullough? Yeah. So that you feel equipped with the information that you need to advocate for the things that the county would like to see happen.
Yeah, and I think that's that general concept of this is the problem. Here's some proposed solutions. These are some things that we could do. Where are those levels of compromise? Ultimately, we're talking to legislators that they're going to have their own idea. And so I think it's the basic, like, this is a burden to us to be able to do this. We're looking for anything that you can do to help us, whether that is the state pays all the costs for Lincoln Hills, whether they do half, whether they reimburse us for some way, shape, or form. We just want to be able to do this and make sure that we're able to provide that service that, well, we're required to provide. So that's why I think part of that is that detail, and I've already talked with department heads as well, is like, once that's done, there's going to be conversations between myself, Supervisor Steen, and the department heads to be able to kind of read us in on the full details, because it's those examples, it's those real life scenarios that are the part of that one-on-one conversation. So
If I may follow up then, so how is this document going to get used? Is this document for you? Is this document going to get printed off and given to the legislators when you meet with them?
it will be sent to them. Yes.
Okay,
But
thank you.
so yeah, I think there's that general language of, how do we get it out there? But I think even however it's done, I would say there's a level of crafting of the specific language that we would probably take some liberties to get that out in a way that meets the appropriate audience.
Mr. Lamb, did you have a question or comment?
And no,
Well, and I actually am glad that we put this on early because I'm getting the sentiment from each of you that we should maybe vote this down and spend some time recrafting.
actually, I did, and I'm just thinking out loud, but like,
Go ahead.
maybe a way to reframe this is, I do believe that the detail is important, but maybe the first thing should be what that, like in the very first one, it's an ask or a suggestion to increase child families allocation CFA by 20%. That could be, that's this is it, and then the why beneath it, and kind of reframe each of them that way. And so I just, yeah,
Is that-
like in the
Would that be acceptable to your staff?
Yeah, I was gonna say either we could do that or I can make a concise statement request. This is what we're asking for, and have a cheat sheet for Dan and team on the side that they could have that information and talk about it if they didn't need it. But so however you want it, we can craft it.
Bill?
Yeah, sure. And then I think, but something with it in writing, because presumably somebody, whether the legislator reads it or not, somebody in the person, his or her staff is going to.
Somebody on the staff is gonna
And,
read it.
and so something needs to be there rather than just be on the side for
Dan.
these query, very persuasive individuals.
Supervisor Steen.
Yeah, just a short tutorial on how the resolutions are submitted to the Wisconsin Counties Association. They got to be presented in writing, and then they have to decide. And we got 72 counties, so there's going to be a lot of asks. And so once we get on the list, whether it's acted on or not by the Wisconsin Counties Association, because they'll pick out what they feel is the most important things. But it stays on the list. You know, so it isn't like you got to reintroduce it every year.
And our local legislators will still
Yeah,
get this.
right, right.
Despite whatever
But-
WCA wants.
So what I'm trying to say is that hopefully that enough counties are suffering the same way we are, that this is a high priority for the WCA. And I'll do my best to try to make it a high priority there, talking to the, you know. So just so you understand how things work, because we're going to do our work, we're going to submit it because that's the way it's got to be. And whether it gets acted on or not, and I'll have a report after they adopt what they adopt, you know. And generally speaking, here's how they approach things. We're not going to ask for 100 things, the WCA. We're going to ask for what we think we could probably get and keep that list relatively short, you know. And so they go through and evaluate what they think is doable. And like revenue, sales tax revenue sharing, that took 10 years to get, you know. So I'm just saying that, but you can't run before you walk. Before you walk, you got to crawl. Well, we got to crawl. So there we go.
But everything that shows up on the county's legislative agenda, I can go talk with
Right.
Yeah.
a
Right.
regional person
Exactly.
about and say, the county
Exactly.
believes this.
Yeah,
Certainly.
right. Irrespective of what WCA has in mind. I swear that I've never done this, but I think we are at a point where you probably need to vote your motion down. And we'll send it back to the staff. Yes, Dan, is that correct?
You could postpone to the next meeting if you'd like as well, or you can vote it down.
Let's
Both work.
vote it down. Or the will of the committee. All in favor?
Maybe some people just want to think.
Aye.
Or,
To,
well,
to accept.
wait,
To reject the legislative agenda as submitted.
But we would be voting. 'cause
We voted to
approve it.
approve.
The motion
So
was
you're
to
going to
approve.
vote no, if you wish. All right, I'm ready to call the question. Okay.
I have a question about the question about to be called. Can we change the motion such that we're directing them to revise this rather than simply rejecting it?
Well, the motion and the second is to approve. So
Okay. Got it. I'm with you. Got
let's
it.
just do it.
Yeah, okay.
If I might, I think that we could vote to amend the motion, saying that to send it back for
Let's just either vote it
up or down.
up or down.
Oh, yes, ma'am.
We
Let's
got the
just vote-
message. We're
Let's
gonna
just
do
vote
it.
it up or down. Let's make it a little more simple. Oh, okay, I'm calling the question. All in favor? No, yes, no, aye. All in favor of approving the legislative agenda? Yeah,
You'd all be opposed.
you would all vote no, nay.
Yeah.
Correct.
So you have to ask.
Correct.
So you have
Yep.
to ask us for those opposed.
Yes, and I was going to ask for those in favor, and I was getting questions.
Oh.
Okay, all right. Those opposed?
Aye.
Nay.
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 All right, all right. The resolution as drafted is being sent back to the staff for revision and clarification and probably shortening. And how are we gonna put this in the minutes? We're not. We're just gonna say, we're simply going to say that the legislative agenda as submitted was rejected on a voice vote. Motion failed. Okay. Is everybody as confused as I am at this point? We have one more thing to do if we're capable. This is a DHS budget resolution. Again,
I so move.
I was grant money and all kinds of stuff, balancing the budget. Paula, do you have anything else you want to clarify on this? All right, so do I have a motion from Supervisor Steen?
Yes, Your Honor.
Okay, is there a second? Supervisor Bashan seconds. Any further discussion? Any further discussion? All in favor?
Aye.
Any opposed? All right, budget amendment is approved. And I think we're done. I think the
Madam
chair
Chairman?
is, at least the chair is gone.
Madam Chair,
Yes, what?
perhaps just to reiterate the meeting time and date for.
Yeah, oh,
December.
yes, thank you. Wednesday, December 17th, 6 PM. And we'll get that on the calendar. All right, thank you, everybody, for putting up with this.
Thank you.
Have a great evening, all.
You all did. Thanks,